One America's Kendall Ford caught up with businessman and philanthropist Foster Friess after he met with the White House press secretary, and the two discussed health care.
Hey there, I'm joined today by Foster Friess, who is an investor and political philanthropist, and you just finished up a meeting with Sean Spicer. You guys were discussing healthcare. What were some ideas that you were bouncing around with him today?
Well, I don't want to share any of his insights, but I'll just tell you where I'm coming from, not that he necessarily agreed with me. But I think healthcare, we have to think about replacing before we repeal. If you had a car that wasn't working well, you wouldn't dump it without buying a new one because you don't have someone take you to work the next day or bus line. So I think that's the first thing I think is important. Secondly, we need to get the public involved. Nick Gingrich says, the American public is clueless. I asked one of the top officials, when will I as a citizen know about what's in the health care? He says 3 days before we vote on it. And I think that was a huge mistake. So what I think first and foremost, as we live in a Christian nation, and one of my favorite verses is, when we carry one another's burdens, we fulfill the law of Christ. And so we have to look out the very, very sick people and the very, very poor people first. And then we can take care of the rest of us. So I have an idea how we take care of the poor people. Number one, I think if we could allow the Treasury, Donald Trump, to write a check to each of the governors then take that money and spend it to upgrade all these federally qualified healthcare centers, clinics, all over 8,000 different clinics in America. So if they had that money, they could increase the salary of the doctor who runs that, and we could tell these people, this doctor is now your concierge doctor. And he might help you get an annual checkup. And so we treat people like wealthy people have concierge doctors. So the more we can help these people, deal with the simple problems. I mean, can you imagine tonight when we have this wonderful dinner, it's going to be a little 8-year-old girl with an earache when we don't do. So if we can take that check and send it directly to this governor, and the governor then sends the check to the little committee, board of directors, that runs that clinic. And they decide how much they're going to pay the doctor, they pay him more, and then they save money on all the regulation that those qualified health centers have on federal laws, and that money can go to fund the rural clinics, because the rural clinics don't get any federal financing. So that's basically how you take care of the poor people, and then I can give you another reason how to take care of the sick people if you want me to.
Well, so you're advocating for state-controlled health care primarily?
Well, I'm advocating for patient-controlled health care. And so this is sort of a realization that some people just need help, that the state could have safety nets. And that's a legitimate role for people to play, because sometimes the costs are so high that the states can help the patients become more invested in their own health care. And that's kind of what we deal with after the sick and after the poor. You and we have the opportunity to spend our own money directly by writing a check to the doctor when we show up. Right now, people have huge deductibles. So if that's the case, why don't we go in the doctor's office and write him a check up to $3,000 a year? I talked to a waiter. He says, I can handle $3,000 a year. I can save up for it. And if I get hit with something, I can spread it out over 3 years, negotiate that. So if that were the case, and insurance companies only had insured from $3,000 to some cap, which President Obama took off, then the premiums would drop dramatically. But in order for us to lower insurance premiums, you can only do that by reducing the underlying cost of what you're insuring. If you have $1 million house, you have 20 insurance companies give you a bid. They're going to be fractionally the same. But if you want to save your premium, you have to go buy a $500,000 house. So what we need to do is return our country to a system of health insurance. Right now, America doesn't have health insurance. There's no health insurance in America. It's prepaid health care. What would your car insurance premiums be if you had to reimburse for tire replacements, tune-ups, and gas refills? People realize the premiums would soar. Well, that's what we've done with health care. So my mission is to try to return our system that we had in the United States, where people pay directly for all the little things, and then when we get hit, there's a larger policy that they can pay to take care of the big things.
So did Sean Spicer give you any indication that he thought that he was confident that they were going to go forward with this health care bill vote this week? Because that's what they've been pushing for.
But see, I think that's a question you ask Sean Spicer. I'm not revealing any of our secrets so far.
Okay,
but I tell you, that guy is phenomenal. He's a perfect guy. He's pleasant. He's honest. He's cheerful. He's kind. I just admire him so much. I think it's a great contrast to how the left deals with people. I mean, some of the nasty things the left says about Ivanka and Jared, it's pretty sad. And I think more people are coming to the Republican side because they're getting disgusted with this nastiness that's coming from the left.
And now, one more question that I know that you might have talked about, and I think you were hinting at a little bit, is pre-existing conditions. What would be your idea as far as pre-existing conditions and how to handle that?
Well, I think, first of all, it's not a good idea to just people sit there and wait until they got sick. So people have to be paying insurance as they go along. But let's say I have a pre-existing, or the pre-existing conditions is you put people in the ability to be as part of an association pool. So let's say University of Wisconsin. Everybody who's an alumni can join that pool. And let's say there's 100,000 lives. They're required to take 1% of people who are the pre-existing conditions are very sick. And then the association can tax or charge $50 per policy to create a little nest egg that can take care of people with pre-existing conditions. Secondly, I don't believe that a person with an average wage earner should be subsidizing someone like me, who God has blessed enormously financially. So I ought to pay according to what I can pay. And if there's people out there who make $200,000 a year, if they make $200,000 a year, maybe they should pay a $50,000 premium. So that would allow the guy making $50,000 not to have to subsidize him. So that gets back to this big issue that the Freedom Caucus is dealing with, is community rating. And so the left wants to put everybody in the same pot, including the sick people. So the insurance companies have to price that whole pot as if everybody's sick. If you take the sick people out and put them in a special category, then you can finance them the way I just mentioned, and then the state can have a safety net if that doesn't cover it. Then they can price that pool according to if everybody is healthy, which again is another way of reducing premium.
Okay, and final question. The spending bill today just basically announced that it would not pull funding from Planned Parenthood. What are your thoughts on that?
I think the secret to that is to reallocate Planned Parenthood funding, because it's a controversial issue as to what Planned Parenthood did with the harvesting of parts. But people forget that the harvesting of parts probably they provide those to universities for research. But where they got into trouble is where they apparently were making money on that, and that's the problem. So if we reallocated that $550 million, in Iowa alone, for example, there's like 113 women health care centers, maybe 5 or 6 Planned Parenthood. So can you imagine how much better care a woman could get if she could go to one of these facilities rather than just Planned Parenthood, which just does sexually transmitted disease and contraceptives? And then people say, well, what about abortion? It doesn't change the abortion reality at one older, because this money is allocated in such a way that they're not allowed to spend that on abortion. So the women would be the big winners, and it's beyond me why you would give it to Planned Parenthood when you could give it to these women health care centers, so you get treated for hypertension, heart, all this sort of stuff. That's my issue.